13 months on almost since the first cases of coronavirus were recorded here in Australia, vaccinations have begun, with Australians right around the country receiving their COVID-19 jabs. For more on this, I'm joined now from Canberra by infectious diseases specialist, Professor Peter Collignon. All right, you might have heard my exchange there with Alan Jones, Professor. People who are wanting reassurance are quick to say, and I think it's fair, that they're not anti-vaxxers. You know, they've had vaccinations all their life, but they're a bit concerned about the pace that this has been brought to market. So what can you give them in terms of assurances that whilst this has happened with alacrity, none of the usual steps and processes have been missed?
Well, I think it's quite reasonable for people to have some, reservations and say, look, I'd like more information for the various reasons that have been given. But the good news so far is that we've had vaccines put out in reasonably record time. And from all the data that's available so far, they appear to be as safe as, for instance, influenza vaccines. Yes, they rarely have, rare side effects like major allergies with the Pfizer one, but no more than you see with lots of other vaccines. And the good news is they're much more effective than, for instance, the influenza vaccine. That may be 30, 50% effective. These are at least 60, some are 90%. So twice as effective on the data we've got so far than influenza vaccines. And more importantly, they're working against a disease that's probably got a 10 times higher mortality rate. So all of it's good news. Do we have all the information we need? No, we don't. We don't have a vaccine for children. There's limited data on pregnant women, for instance. With the AstraZeneca, we need more data on those over the age of 70, 80, but it's all coming in. And the really fortunate position we are in Australia, we're going to have a slow rollout relative to this because we don't have unbridled community transmission like America, like Europe. So we don't have to overly rush it and take shortcuts. We can learn from the tens of millions of people or hundreds of millions of people that are vaccinated overseas. So if there is some unexpected problems, we will know about it. But so far, it's all looking good. And when my turn comes, probably in a month or so, because I'm in the second tranche of medical workers that have to get vaccinated, I will be lining up because I haven't seen any data so far that tells me this is not a good thing to have, whether it's the Pfizer vaccine or the AstraZeneca one.
What about elderly people, though, with the research that came out? I think it was out of Scandinavia in relation to elderly people with AstraZeneca. Should we be concerned there? Should we be saying to elderly people, you really should be trying for the Pfizer vaccine, not the AstraZeneca?
Well, whichever way you look at it, you'll find some problems. You might remember the Pfizer vaccine in Norway. There was an issue about did you have people dying more often straight afterwards? Now, in the total scheme of things, if you've got people who are in nursing homes with underlying diseases, unless you do a proper study, you will find more people die after they get the vaccine or placebo for that matter. But so far, there's no evidence that that vaccine causes more problem. The trouble with the AstraZeneca, there's not that we don't know it works. In fact, all the available evidence is that people who are older, if they get vaccinated, it stops them from dying and going into hospital. Much more effective than, maybe stopping transmission altogether. But that's mainly what the vaccines are for. We want people not to die and we want people not to go into hospital. And there's no data to suggest that's not happening. Now, do we need more data? Yes, we do. And part of in fact, in Europe and America, part of the emergency regulations is that the drug companies collect more data. Well, I think that's vitally important as we go forward. We need to know, is this 90% effective? Is it 60%? Is it 95%? And for both transmission and serious disease. We don't have precision answers around that, I think, for all the vaccines, in fact, particularly when they're rolled out into the real world rather than in very regulated drug trials. But so far, it's all looking good, but we need to collect more data in all age groups, particularly the ones that haven't been looked at as much as we would like. And if any new variants come, we need to know, hey, is it still effective? But so far, the overall news about efficacy looks good, and the overall news about safety also looks good. But we need more data and we need to keep on studying this.
Right. Well, now we've got to day one on vaccinations. Now they're being rolled out. Surely this removes any argument from premiers that they have to lock down states or citizens from here on in.
Well, my own view is some of the lockdowns more recently have been arguable even without the vaccine. But from now on, we'll have more and more people vaccinated. And the particular groups that we have to protect are the people who are much more likely to die. And you've got to remember, the vast majority of people who die are over the age of 80, often with underlying medical conditions. So once we roll this out to mainly all the people over 70, and particularly people with underlying medical conditions, that means even if the virus spreads, the death rate will be markedly down, probably at least 90%, maybe more. Also, by protecting the quarantine frontline workers who are more exposed than all the rest of us to COVID potentially, plus frontline healthcare workers, particularly those looking after COVID patients or if they get sick, it means we've markedly decreased both the risk of transmission, but very importantly, the risk to those who are most likely to die and make up the vast majority of deaths, even if it does move around. And the reality is also in Australia so far, other than Victoria in last winter when there were some factors that need to be improved but have been, every other cluster we've had in Australia has been contained by case finding, quarantine, isolation and cooperation of the public, be it last December with Sydney, be it Melbourne with their hotel outbreak, and all the ones in Perth, Melbourne, Adelaide, Brisbane, all of them have been contained without the lockdown making any difference in the last 6 or 8 months. So we've got a track record of success. So if we can stop the most vulnerable people decreasing their risk markedly of dying, plus we keep up what we're doing, we should be able to keep this well and truly under control and therefore not need lockdowns of state borders and, closures and all the things that have been very much an example over the last 6 months or more.
I tell you what, in Victoria, particularly Melbourne, if the Premier said there would be no lockdowns if people had a jab, I think he'd find it would be a very persuasive argument. Peter Collignon, thank you for your time.
Thank you for having me.